All right, good day, everyone. You are welcome to another episode of the Yaba Voice webinar. This month, it's a very unique month because it's the month that we get to celebrate the World Suicide Prevention Day, which was celebrated on the 10th of September. The theme is changing the narrative on suicide. And it's the day that the whole world gets to understand more on what suicide is, what the causes are, as well as how we can, as a universe, have better understanding on society. You're welcome once again. Before I run off, I want to thank the medical director, Dr. Rubenga Adekile to formally welcome you to this webinar. Over to you, medical director, sir.
Thank you very much. Thank you very much, Dr. Kemi Akitoyesi. You can see that I'm speaking from a faraway National Postgraduate Medical College program. Good afternoon, everyone. I warmly welcome you to this month's edition of webinar by Yaba Voice. Yaba Voice is a platform for mental health, education, advocacy, and community outreach. It is a social media platform of Federal Neuropsychiatric Hospital, Yaba, Lagos, through which the hospital creates awareness and educate the populace on topical mental health issues. Today's topic is changing the narrative on suicide. Changing the narrative on suicide. As we all know, suicide is the act of taking one's life voluntarily and intentionally. It is estimated that about 800,000 people commit suicide annually worldwide. And studies have shown that there is one suicide death every 40 seconds. And not that alone. And worldwide,
All right, we lost the MD of some few minutes there. We hope that his network would permit him to.
11 per 100,000 people, while Nigeria ranks 10th in Africa among the nations where this issue is said to be rampant. And suicide is one of the leading three causes of death among the most economically productive and viable people between the age of 15 and 44 years. And more males are more affected than females. Now, in today's webinar, there are many questions to be addressed. For instance, what do we understand by suicide and deliberate self-harm? How important is it in every nation? What are the risk factors for suicide? What are even the causative factors, or what are those things that makes an individual commit suicide? How do we recognize an individual who have tendency to commit suicide? And how do we change the narrative of suicide being a crime in Nigerian law? To address this issue, our great mental health experts today, I have with me Dr. Maitomi. Dr. Maitomi is a consultant psychiatrist at the Federal Neuropsychiatric Hospital, Yaba, Lagos. He has a first degree from the College of Medicine, University of Ilorin, Kwara State, where he had his Bachelor of Medicine, Bachelor of Surgery. Because of his passion for mental health, he went into the field of psychiatry and acquired his fellowship in psychiatry from the West African College of Physicians. Dr. Maitomi has more than a decade experience in the field of general adult psychiatry, both in the public and private sector. He also has other interests in forensic psychiatry, suicidology, and advocacy. His hobbies include public speaking, talking mental health, reading, and watching movies. Our second presenter for today is Dr. Adeni Bunyo Peter. Dr. Peter is the Chief clinical social worker at the Federal Neuropsychiatric Hospital, Yaba, Lagos. He attended the University of Lagos for his first degree in guidance and counseling, and a second degree in social work at the Ladoke Akintola University. And also, lastly, he has his Doctor of Social Work from the Lagos State University. He's a qualified addiction professional and a master trainer for the Colombo Plan. Dr. Peter holds an international certification in addiction science and in prevention, treatment, and recovery. Not that alone, Dr. Adenibunyo enjoys cooking and has talent for making people laugh. He's happily married with children. Our next presenter is Mr. Donald Olawale. Mr. Donald Olawale is a licensed clinical psychologist with specialties in substance use disorder, anxiety disorders, depression, trauma, relationship, mindfulness-based therapy. He has over 10 years experience in the management of mental disorders, providing safe, empathetic, and non-judgmental space for individuals to explore their thoughts, emotions, and behavior. His approach in his profession is that of collaborative, compassionate, and tailored to each client's unique need. He believes in empowering individuals to develop coping strategies, improve relationships, and enhance overall well-being. Currently, Mr. Donald Olawale is a doctoral student at the Obafemi Awolowo University. He also has a Master's of Science in Clinical Psychology from the Obafemi Awolowo University and Bachelor of Psychology from the University of Ado-Ekiti. He's also a lecturer at the College of Health Sciences and Technology, Ijero-Ekiti. And he has many professional affiliations, among which are membership of the Nigerian Psychological Association, Nigeria Association of Clinical Psychologists, Employee Assistance Program of Nigeria, etc., etc. You can see that those who we have on the platform today to discuss this topical issue are well versed in their area of discipline. I want to encourage all of you to kindly relax and listen to our mental health expert as we promise you a rewarding session of today's webinar. Over to you, Dr. Kemi Akitoyesi. Thank you.
Thank you so very much, Medical Director. You would see the commitment of the Medical Director in ensuring that this program is far away, is not available currently in the hospital, or he has also Olugbenga Adekele will say, thank you, sir, for your continued support in ensuring that the Yaba Voice keeps running and that we are a beacon of hope and support to a lot of people. Thank you very much, Medical Director. So we can start this conversation, but please remember that you can join us either on Zoom here, or you can also join our Facebook page to join this conversation. Send a reminder to family, friends, and colleagues, and also to some religious affiliations that you belong to. This is a conversation for all, and everyone needs to be a partaker. Dr. Mike Tomei is ready, and he's going to kickstart this conversation to us today, and he's going to talk to us about what is the current trend on suicide. We are looking at changing the narrative, but what's the current trend? Over to you, Dr. Mike Tomei.
Thank you, Dr. Kemi. It's nice to be here today to talk about mental health and suicide. So as has been said, suicide is simply defined as the act of taking oneself, taking one's life, or the act of harming oneself with hoping that one would die. It's a public health problem and mental health problem as well. Now, how prevalent is suicide? Like has been said, worldwide, about 800,000 deaths from suicide. One death every 40 seconds. But that's not the whole story or the whole picture. There are those in the waiting room. It has been said that there are about 13 million people think about suicide every year. about 4 million people plan to take their lives, and about 3 million people attempt it. That's a grim picture painted there. So how about in Nigeria? Nigeria, as of 2019, it said about 6.9 people to 100,000 people commit suicide. That is 7 people in every 100,000 people, some people will commit suicide. That was as 2019. But as at 2012, the number was 6.5. That's an increase within a span of 7 years. That's also not encouraging. So which people are vulnerable to suicide? Which people commit suicide more? Suicide is commoner in men. In the past, it used to be said that it's 2 men to 1 woman. Now it's about 3 to 4 to 1 woman. The young people commit suicide more compared to the elderly people. Those below the age of 29 and elderly above 65 years. This age group is the working class age, of course, and that means that says a lot. Also, there are some vulnerable people who are prone to commit suicide, people who are undergoing or who have gone through hard times like wars, like Nigeria now, kidnapping, terrorism, disasters. Then those in IDP camps, inmates, those who have suffered a heartbreak or a loss are all people who are vulnerable to committing suicide. There are also people who have chronic medical problems, especially those that are in pain. I think some years ago, there was someone who committed suicide along the bridge. I think he said he had sickle cell disease and epilepsy. Also, another group is those people that have mental health problems. Chief of this is depression. It's said that 20% of people with depression will commit suicide compared to other people who have other problems like alcohol and drug abuse, bipolar disorders, schizophrenia, etc. So you can see that this paints a very rather sad picture for us. Suicide is on the increase, and this is the time now to stem the tide and bring those figures lower and, if possible, prevent suicides. Thank you.
Thank you so very much, Dr. Maitomi, for that. I know what he had started with, it's looking very grave because realistically, it's showing that quite a whole lot of people are prone to it. And with so many things happening in our world today, then it's becoming a whole lot difficult for so many people to be able to cope and deal with all of the things. Now, he had opened up this conversation for us, and then we'll be moving further to understand again what are the social factors available in our environment that could be responsible for suicide. Remember, you could also invite friends and families. Remember to invite friends and family to be a part of this. Um, and these comment questions are also welcome. So we would invite Dr. Peter Adeniboye to go on with this question.
All right, thank you very much, Dr. Akintoye. I also want to thank the medical director for this privilege also to talk about social factors that precipitate people to commit suicide. And based on what Dr. Matami have rightly said, that suicide is an acute, deliberate act of self-harm resulting in death with at least some intention to die, which is also one of those areas that we also have to bear in mind. And looking at suicide as well, we can look at it from 3 areas. The first one is someone having suicidal ideation. The second one is someone to have a suicidal attempt. And the last one is someone to eventually now carry out that suicide. So when we talk about factors, they're different, or we have so many different factors that may be responsible for people committing suicide, or a situation whereby things can trigger people committing suicide. And people used to say that family is the bedrock of every or any society. So family is key when it comes to issue of suicide. So in any family, if a person in the family lack or doesn't have this kind of social connections, can also precipitate someone to be having this idea or this ideation of having suicidal ideation. Then feelings of loneliness can significantly increase the risk of, suicide. People who feel disconnected, from family and friends, often experience higher level of despair, and definitely they feel like killing themselves. What about financial instability? Financial instability is also one of the reasons why people feel like killing themselves, apart from even financial problem. What about unemployment rates that we have in our society? A lot of all these graduates, they are unemployed, and the level of poverty, in our country now is so at alarming rates, and people are hungry, and we are just praying that people should not get angry, because the rate of poverty level in our country now can precipitate a lot of people to commit suicide. And economic hardship can also create a sense of helplessness, and also contributing suicidal thoughts, which can also lead to attempts. What about loss and grief, which Dr. Matomi also talked about? Experiencing the death of a loved one or significant loss can also trigger intense emotional pain and feelings of hopelessness, which can also contribute to risk of suicide. I was having a conversation with one of the professors that lost her husband recently, and she was telling me it's not easy, to lose a loved ones like that. So it takes a lot for people able to curtail all those kind of grief. Apart from that, what about severe mental illness or disorders? People having depression, anxiety disorders. In fact, some people also might be having co-occurring mental disorders. When you have one person having 3 or more illnesses at the same time, having mental disorder, substance disorder, at the same time, medical disorders, this can also precipitate a lot of people to start thinking of, what am I still doing here? Why can't I even take a relief and just go and rest? Then chronic illness and pain, when people are having chronic illnesses, can also precipitate them, to start thinking about how to just end everything, pain all every time, and they have been spending a lot of money, look for help here and there, but unfortunately, we didn't get pain, especially when it comes to physical pain, and that can also, increasing the risk of suicidal ideation. What about severe substance use disorders? Especially alcohol, which is also rampant in our community. In these days now, you see alcohol in sachets, it's more or less like anybody can have access to it. So it can also impair the judgment of people under the substance use disorders, and also increase impulsivity. And this can also leading to a higher risk of suicidal behavior. What about overdose of all these PWID, people with injectable drugs? So this can also be one of those reasons why people might also, kill themselves. What about traumatic experiences? Life traumatic experience, PTSD, and abuse. When people experience traumatic, such as physical, emotional abuse, all these can become a problem. What about cultural expectation? Different cultures have varying expectations about success, especially about the Igbo people. They believe that you must make it by fire, by force. And this can also precipitate some people to look down on themselves. But my friend has built a house, he has a car, he has children. So what am I still doing here? And I'm still here. So feelings to meet this expectation can also lead to feelings of inadequacy and despair. What about stressful life circumstances? Job loss, continued unemployment, divorce, separation, conflicted relationship. You see some children describing their home as a chaotic home. That I don't want to live in this kind of house anymore. This family is chaotic. Okay, so this has set up people that can trigger people to start thinking or having suicidal ideations, and at the same time start looking at means of committing suicide by either taking all these drugs or different kind of medications that can also terminate their lives. What about legal implications of legal problem? People having legal issues, going to court here and there, and at the same time have not been able to get justice. So there are a lot of factors, but let me just stop here so that we can also hear other people's view. Thank you.
All right, so thank you, Dr. Peter Adeniboyo. What we're looking at now are some of the social factors in our environment, especially within the context of our nation, that could make an individual to commit suicide. And I hear him say, yes, loneliness. And as he mentioned that, one of the things that came to mind is this issue of Japa syndrome, with a lot of people leaving their family members and every other thing. The other ones are left alone. Who cares for them? Who takes care of them? Who ensures that they are fine? And a lot of them are not able to access care and help as much as those. And that's one teeming problems that I don't think we're even very prepared for, and unemployment, and the fact that it's even getting worse by the day. If you go out now, people are going into armed robbery and other things like that, and that could also be a whole lot of things. Now, Mr. Wale Biyoku will be looking at some of the psychological factors that could be responsible for suicide. Now, we've seen this social, but let's look at the psychological factors that could be responsible for suicide. Over to you, Mr. Wale Biyoku.
All right, thank you very much, Dr. Mizaki Tsuishi. Well, like my earlier speakers I said, suicide is a deliberate attempt for someone wanting to take his life. And there are a lot of factors that actually be responsible. I will be looking basically at the psychological factors that could be responsible for someone wanting to take his life. And the first one of those factors has to do with when an individual has an underlying mental health condition. An underlying mental condition such as maybe a mood disorder, depression, bipolar. These are conditions that can actually predispose an individual feeling hopeless, feeling worthless, having low mood, and the next thing, you just find out that the individual start isolating himself, just feel like, oh, let me just end it all, let me just kill myself. So when an individual has an underlying mental health condition, is one of the major psychological causes. Other conditions too, other medical conditions such as anxiety, schizophrenia could also be responsible for an individual who wants to take his life. Then we also have substance use disorder. Substance use, like today, we have a whole lot of substance. And most of these substances, in fact, most of this new generation substance, predispose an individual to want to feel so worthless of himself, feel like, oh, I'm so useless, I can't do anything for myself. And the best way we'll be thinking about is just find an easy way out. And the easy way we'll be thinking about is just to attempt suicide or to want to die by suicide. So we also have personality disorder too. Personality disorder, some type of personality as actually is responsible for actually predisposing an individual to want to die by suicide. And one of them has to be borderline personality disorder. Once an individual has borderline personality, which has to do with emotional regulations, you find out that such individuals, they find very difficult to control their emotions. They want to feel what pains look like. They want to feel, they have this odd and eccentric feelings. They want to do a lot of things that will make them ease pain and whatever. Before you know it, they'll end up eventually dying by suicide. Then we also have adverse life events. In our society today, we have a lot of things in the environment which could pose as a very, very as a kind of adverse life event, such as loss of job, relationship issues, divorce, separations. All these issues are around us, and if not properly managed, all these issues can actually lead someone to having suicidal ideations and even thought of dying by suicide. Then we also have significant loss. When you lost someone very dear to you, you don't grieve properly, you didn't have time to actually grieve. All this can actually predispose, and if you are feeling that state of want to take his life, or want to just end it all by dying by suicide. Then unmet life achievements. When you intend to achieve some basic things of life and you find it very difficult to achieve, oh, my friends are doing very well, I could not do very well. Oh, these are something when you are seeking that validation from people outside. Oh, I've not been doing very well for myself. So all these are unmet achievement. You can't achieve what you say. These are things that will actually predispose an individual wants to take his life. Then we also have physical and emotional pain, which is very, very important. Some people, their intention is not to even kill themselves, but they can't just deal with that pain. Whatever pain it is, it might be physical, it might be emotional. They cannot deal with this pain, and the easy way out is for them just avoid that pain is just to take them life. So we have so many cases of individual of such who see an escape route in taking their own life in a way of evading such kind of emotional or physical pain. Then we also have trauma and past experiences. This trauma could be as a result of unresolved childhood abuse, childhood neglect, a lot of things that happen in childhood and probably at the later stages of life start playing out. All these factors could actually be responsible for that individual thinking of actually wanting to end his life. Bullying in school, especially.
Let me cut you here. Thank you. Because of our time. Thank you so very much. I know you have quite a whole lot to say.
Okay, so thank you.
Yes, thank you. You have mentioned the mental health, your mental substance, and other things like that. You have mentioned all of that. Personality disorder. I think one thing you just mentioned, and somebody was asking a question yesterday, and that was the fact that aren't we all mentally disordered in Nigeria at the moment. It's going to look like everybody's just going to one thing or the other. But we will begin to understand more as we go on in this conversation to look at, yes, maybe the sign and then how to do. So please don't go away until we finish this conversation this afternoon. And Dr. Mike Tommy will be talking to us about the signs and symptoms. How do you know? What do you see? What are those things to watch out for that would help you to be able to understand what's going on with the individual? Over to you, Dr. Mike.
Okay, thank you, Dr. Kemi. This part is really very important, and because we need to be able to identify those people who are on the verge of harming themselves. Okay, suicide is a cry for help, and most times when someone has committed suicide, that is the end. There's no coming back from it. However, we need to identify and catch them before they harm themselves. That's why we're going to take this session right now. So I mentioned that one of the main problems with people who commit suicide is that they're depressed. So what signs do you see in people who are depressed or symptoms? One is that they may cry a lot. For example, you see a grown man crying in public for no reason, wasn't beaten by anybody, was crying in public. Low mood that is pervasive. Everybody has low moods once in a while, but these ones are very pervasive in the sense that they are there for a long period of time, 2 weeks or more. Then we have things like feeling weak all the time, losing interest in things he used to do before. For example, enjoy playing basketball, playing football, stop doing all those things. Then people to lose interest in work, or someone who goes to work, they can't focus at work, makes a lot of mistakes, or those in school for the young people, their grades drop, or they entirely skip school completely. The other things could include that poor sleep, or sleep is unrefreshed, poor appetite, weight loss. As it gets more difficult, as it gets worse, here you have things like hopelessness, which is one of the issues, one of the severe symptoms you may have or signs you may have. There's helplessness, there's worthlessness, there's low self-esteem. Other things you could see as it gets worse would be that person begins to listen to dark music, dark humor, wearing dark clothes, person becomes isolated. So it's kind of things you see in people who are depressed. Other things could be that the person gives you signs. Like I said, there are always signs. Someone posted on our group that a colleague or alumni killed himself some time ago, and the wife said she didn't notice anything, but there are always signs. One sign we look out for is person begins to write his will. Person gives messages, hidden messages on WhatsApp, on Facebook, on Telegram. Those messages that I want to go, I'm leaving. Person also gives out these things. So those are things we need to look out for. And please, when someone says, I'm tired, I want to do this, let's take this person very, very serious. They're not trying to make fun, they're trying to say, cry for help, and they need attention. And lastly, one thing they do before they take their life is some may begin to self-harm. Self-harm could be cutting themselves, some could be stabbing themselves, could be engaging in risky behaviors. For those that don't cry, like I said, men shouldn't cry. Some may not cry, but they would immerse or drown themselves in alcohol or drugs. So certain things one needs to look out for before it gets bad. So once you notice those things, what you should do is get person help as soon as possible. Thank you very much.
Thank you so very much, Dr. Mike Tommy, for that. Now, he has told us some of the things we need to watch out for. And so it's quite important that we do not begin to underplay the cry for help. I love the way he started that. It said it's a cry for help. And so most times when you start seeing the individual crying for help, let us not minimize it, or let's not underplay it, or let's just not just throw it away and say like, oh, no, it's not possible, because quite a whole lot of people would eventually carry it out. That's what he had heard him say. Now, Dr. David Buyo would begin to tell us, now, even for a whole lot of people who are actually crying for help, it's still a lot difficult for them to come to the hospital or to get help or for intervention and other things like that. But what are the factors that makes it very difficult for individuals with suicidal intent to access care? Over to you.
Thank you very much, Dr. Akintoye. And yes, it's good to cry for help based on what Dr. Matami said. Because we're all social beings and there's need for us, we need one another. I'm looking at some of those factors that might, hinder some people or make it difficult for individuals with suicidal intent, to access care or call for help. As we already know that many of us also know that the issue of stigmatization or stigma is also rampant, especially in all cultures. So many individuals may feel ashamed if they disclose their mental health struggle with other people. So this stigma can prevent them from seeking help or discussing their feelings. And this can also lead to worsening their mental health issues. Then I can also, precipitate, them thinking about they can't help themselves anymore because probably nobody is listening to them anymore. And that can also bring about hopelessness and worthlessness. So like people can say, oh, what will my friend think of me if they find out I'm having mental challenges? So that kind of stigmatization is a more or less like unseen stain, that people is having all these things. So that might also be one of the precipitating factor why people doesn't want to access care. Lack of knowledge is another point which I also want us to also consider. Someone who is feeling suicidal, may not recognize the severity of their situation. It might be mild, moderate, or severe. So they might not initially, get to know that this is there's need for, for concern for people to help them. And in fact, they might not even know that there's a help that is available, for them. So people may understand, they may also underestimate their feelings or assume that they can handle their problems alone. And some also feel concerned. Also, people also have this kind of concern that, oh, if I go to the hospital, I hope they are not going to being hospitalized, because they are going to be labeled as being crazy, being labeled as being crazy or experienced. And some of them are also be thinking that, for instance, let's give an example of someone working in multinational industry and walk up to his boss and say, sir, I have to see a psychiatrist. And coming back to the hospital and say, sir, they have asked me to go come on admission. So after the admission, do you think they will still retain her in that kind of position as a PR of the organization? So these are some of those things that make people not want to, seek help. So they might think, I don't know what to do. And at times they don't even know what to do. And they feel this kind of helpless at this point in time. What about lack of limited access to resources? People living in rural area might have few options of mental health facility or even see a professional, within a driving distance. Many of our patients leave their home around 4 a.m. to come to Yaba because they want to see the doctor on time so that they can go back, to their places of work. So distance can also precipitate a lot of people from coming for help because one, they have to spend money on transportation. Two, they also have to spend time, traveling inside the hold up before they get to the hospital. And, this can also become a problem. What about financial barriers? Can also become one of those things. The cost of mental health services, can be prohibitively high, for some. And they might think, I wish I could see a therapist, but I just can't pay for it, So these are some of those factors that can also help. Lack of, support from families and friends, can also become a problem. And when the therapist or counselor or the psychiatrist asks them to come over and over and again to resolve their issue, might also become a problem. So some of them might not feel like coming. What about cultural factors? Cultural belief can influence individual attitude towards mental health and at the same time seeking help, especially from some people who believe that, oh, to talk about mental disorder in our family is a taboo, all right? And that person might be struggling, in order to look for help. What about fear of consequences? All right, a worker might worry that informing his employer about their mental health struggle can lead to being fired or missing out on promotions. When they now discover this person is having mental disorder, so don't give him that responsibility. So don't promote him to that kind of high, responsibilities because they've been misused. They also have this misconception about this person having mental disorders. Then we also have a lot of people who also believe that they can do it all by themselves. And doing it all by themselves without a therapist can also lead to more damages, because a stitch in time saves nine. So if they come around and see a therapist, a psychiatrist can also help them to do well. But fortunately, they might, having difficulties in assessing, having more, all these financial issues that can also precipitate them from having access to a therapist. Thank you.
Thank you so very much, Dr. Adenibuyo. That's quite germane what he had raised. Starting from the fact that we're looking at the issue of stigma, which is one very critical factor that we need to start talking so much about in our environment here. Because for a lot of people, they don't want to even talk about it because of the associated stigma. And you understand again in our society, because from what Dr. Matomi and the medical director had said earlier about the people who could be more prone to suicide being men. And men don't talk about these things. We don't communicate about it. You are presumed to be strong. So if a man says, I have problem, I'm thinking of killing, why? Or even in our cultural beliefs, it will say, just do the acting thing, just be strong. And then, you're expected to just always carry the responsibility and the burden and every other thing. And these are many more other things that Dr. Adenibuyo has mentioned are critical factors that makes a whole lot of people not be able to access help the way they should access help. But Mr. Wale Biyoko would be speaking with us now, and he will be talking to us about the protective factors in our environment that can mitigate against suicide. Now we have learned about all that could have brought it on. We have seen the signs and symptoms. We have seen reasons why people may most likely not come. But what are those protective factors around our environment that even could save us and spare our lives even the more? Over to you, Mr. Wale Biyoko.
All right. Thank you very much, Dr. Akitorishe. All right. So we have a lot of protective factors, that could guide us against committing suicide. And the first of them has to do with strong social connection, especially with our environment. You understand that no one exists in isolation alone. We all need each other. So you should definitely learn how to communicate appropriately, connect with your environment, reduce every form of isolation. So by doing that, you have a very strong protective factor against suicide. The second one has to do with effective coping skills. Most of the problems we usually encounter is having an ineffective coping skills. We don't even know how we can cope with realities of life. So once you're not having an effective coping skills, it's definitely you already start having most of those symptoms that are suggestive of low mood, suicidal ideations, and the rest of that. So if you have a very effective coping skills, is a very, very good protective factor against suicide. Next one has to do with access to mental health care. Once you find out that you're not feeling better, it's always good for you to seek for help. You seek for help, go to the right place to actually get help. Talk to somebody. When you find out that you're not feeling too well, you're not getting yourself, you're worrying about a lot of things, you just want to talk to somebody. That's the essence why we have clinical psychologists there, why we have doctors there. You just want to express yourself, just want to talk. So access to mental health care is actually one of the very, very good protective factors. Then problem-solving skills or problem-solving abilities, it's one very, very important protective factors. Most of the times we don't really have we don't really know how to solve most of the problems or all the issues we find ourselves. But when you're well equipped with problem-solving skills, problem-solving abilities, you're already ahead in preventing yourself against whatever depressive symptoms, whatever suicidal ideations will better. Then this cultural and spiritual beliefs, whatever you believe in. A lot of people have, like, this part of the world, we have a strong belief in our culture. We have strong belief in our spirituality, whatever you believe in. So when you leverage on most of these things, it helps you. It's more of like a buffer. It's more of like a protective factor against suicidal ideations or suicide generally. Then the role of social media is actually very important. Like we all know, social media could either be positive or be negative. So reduce access to some certain content. In social media, it could be very, very helpful. Not everything you should you should be interested in watching. Not everything you should be interested in. So reduce access to some certain content will actually help. It's more of a protective factor because these days we are in the social media age where everything is on social media. So you shouldn't be interested in everything on social media. I think I'll just stop here. Thank you very much.
Thank you so very much, Mr. Wale Ibioko. And one of the things I hear him say is the strong social connection. But you know, one of the days when we have strong social connection, in time past, everybody belongs to a family. No, you come together, there is that bonding. But today it's like everybody to your tent or extra. Everybody's just on their own, doing their own things. And that connection, that bond seems to be missing. Maybe by the end of this webinar, you'll be able to tell us what and what to do to be able to reenact that and then to be able to bring it back together. And I hear you talk about the four coping strategies, the problem solving. I know when people don't have good problem solving skills, the tendency is that they get frustrated very easily, and that creates lots and lots of problems. And then again, I hear you talk about the religious affiliation, because as you were talking, I was already thinking about that, and maybe the role our religious organizations play in mitigating against suicide. Maybe you would look at that by the time we'll ending this conversation today. But as we continue in this conversation, remember you could drop your questions and your comments in the chat box. Our speakers are well equipped and knowledgeable enough to be able to attend to them. All right, so Dr. Mike Tomlin was talking to us about the change we need. Now, remember the topic is changing the narrative on suicide. And so he will be talking to us about the change we need. How do we move from the current trend to a more acceptable face, even in terms of suicide management and dealing with the realities that are associated with suicide? Over to you, Dr.
Yeah, thank you, Dr. Kemi, once again. I'll take a cue from you, and I'll quickly talk about, once again, where we are right now. I'll drop some figures again. Between year 2000 and year 2018, suicide rates rose about 3.7%. And then between year 2000 and 2022, it dropped by 5%. But between 2022 and now, it has gone back to its former rate. I mean, suicide is once again on the increase. Of course, that stands to reason from what you've all said. The socioeconomic issues in Nigeria are biting, issues of terrorism and strife. So quickly, before I go into the remedy and things we need to do, I would like to say that people need to speak up. We need to talk about your problems. Let someone know there's always hope. Suicide is not the way out. So one thing we need to do is, like I said earlier while talking about the signs and symptoms, we cannot turn a blind eye to your neighbors or friends or these are people's fathers, brothers, uncles, breadwinners. First thing you need to do is, if you see someone who has these things I mentioned earlier, those symptoms, visit a hospital. A hospital here is open 24/7, and we have professionals who will attend to you. At times, if you don't have money, it can be pro bono. My MD has spoken earlier, can be pro bono if you don't have the money for it. But please don't die in silence. Visit a hospital. Visit a hospital. We are non-judgmental. We keep your secrets, so that because stigma is everywhere and it's on the rise. Also, the media has a role to play in stemming the tide we have about on suicide. There should be media should not glamorize suicide or make it trendy, because in recent past, one thing that leads to suicide is when the social media pretends it's as something trendy. There are suicide spots which the social media fails to recognize, and you report suicide, and people tend to commit more suicide rather than avoid it. So when important suicide, avoid mentioning the instruments or the places people committed this act. Also, we need to increase our surveillance. I can tell you for a fact that the rates of suicide are far more than we have mentioned because of low reportage. Hence, we need to do more of surveillance, be more sensitive to our neighbors, our friends, be more welcoming, be more caring, more supportive. And I'm sure with that we can reduce, stem the tide of suicide. Also, in our country recently, in other countries, you hear that suicide is not a criminal act, but Nigeria is a criminal act and carries a 1-year jail term. So you can imagine someone who is crying for help, tries to harm himself, he's arrested and taken to prison. So you are flogging a child and asking him not to cry. So I think we need to the government has to wade in at this point to decriminalize suicide. Also, the issues of stigma, I'm sure some of my colleagues have spoken about it already. Stigma has to be dealt with because you hear shouldn't cry, shouldn't show emotion, and all those things tend to make people more isolated. And when they are down, you wouldn't even know. This goes to say that we need to do more of awareness, do more of counseling. We need to visit schools where they find young people, educate them, go to schools, a place of worship, stadium, places of where sports is done to catch these people and educate them so that it's better to prevent it than to cure it. So one thing I did mention earlier is that for everybody who has attempted suicide, the risk of doing it again is higher, and the risk of completing it is also higher. So it's better we'll catch them young, go, like I said, go into the streets, go into the churches, mosques, schools, universities, into homes as well, and do a lot of education. The media also has a part to play in this. Government too has part to play as well, like I said. Socioeconomic issues, hardship tend to also make people push people over the edge. So the government has a role to play in alleviating people's suffering, ensure people ensure that there are things that will make people break down are removed or alleviated or ameliorated. Such people would to lower the risk of suicide. I also want to add once again that we have a very robust psychiatric unit in Yaba here, one foremost in Nigeria, and we'll be willing to see you if you have any complaints. Lastly, there are helplines that are available. Should you have any reason to feeling low, feeling down, and someone to talk to, you can always call in and we'll be available to speak to you. Non-judgmental, confidential, and I'm sure by the end of the day, you'll feel better for it. Lastly, suicide is not the way. There's always hope. You're not alone. Please speak to someone today. Thank you very much.
Thank you so very much, Dr. Maitomi. And one of the things you opened up with was the fact that you said speak up, speak out. There was a program in those days, they used to call it Speak Out. And it was a program that gave a safe space for people to be able to talk about the issues and just communicate about it and be able to deal with the realities of life. And I think this is what should also go on more. The conversation should tend towards allowing people to be able to talk about the issues in a non-judgmental way that would also help them to be able to seek and get the help that they need, their sensitivity. And then it's also very intriguing that you mentioned the fact that in Nigeria, if anybody commits or tries to take their life, it's a criminal act. And so it means you will still be, put in prison for that, which shouldn't be. This individual, we have established that it's a cry for help. And these are some of the things that we need to be able to do or in changing the narrative of suicide. Thank you so very much, Dr. Adenibuyo. We'll be talking about what are the social structures What are the things that maybe individual, family, governments, and every other thing needs to put in place in order to enhance better functioning for individuals, not just people who are having suicide, but maybe everyone in general? Over.
Thank you very much, Dr. Akintoye. Thank you very much, Dr. Matomi, for your submission about substance use, mental disorders. Well, for me, I think that looking at the factors and things we need to put in place, like what are the structure that must be put in place to enhance better functioning. For me, I think we can look at it from two perspectives, tangible and intangible. Tangible in the sense that let me even also address all our policymakers, all the people that are in charge of creating wealth in our country, especially the ministries. The mental health is also important. They should make a policy to make sure that there's they establish many mental health services in our primary health centers, and well equipped with all these therapists who are well versed in helping people. Instead of traveling far distance to come to Yaba, they have all these local government, and they also have all these primary health centers. So they can equip all these places as well, and making sure that people have access, to mental health, and at the same time able to see a professional. Dr. Masomi also made mention about issues that has to do with mass media. Yes, education and awareness program is also key and important. So there should be a way of conducting workshops or seminars, in all the town halls, especially when you talk about town hall meetings. There should be also something for people to come around and learn about mental health and the best way they can help people, living in that community. So what are the signs, during that seminar, during that conference, signs of suicidal thoughts, ideation will be shared among people. In fact, people there and then can also try to get understanding that this person is having suicidal ideation because the way he's behaving is more or less similar to what we've learned, during the town hall meeting. So if you have all these areas in place, all these things in place, it's going to really help. What about peer support, network? In some culture, we have what we call age grade. Age group, they come together every year to help themselves to work together. So I also believe that during that period too, they can create a space, for individuals to share experience and emotions. Peer support groups can help foster connections, at the same time also reduce feelings of isolation, which is also one of those factors. What about engaging our youth? Youth should be made to be useful. Our youth should be useful. So they should focus, there should be some programs that focus more on programs for youth that will involve, our young people about, bringing about mental health initiatives, teaching them about resilience, coping strategies, and how to recognize when someone might also need help can also be a thing that we can do in our own community. What about during the crisis? What do we do during the crisis? Our law enforcement agency should be trained, how to help people. Like when someone is having headache, you cut the head because the person is having headache, you now cut the head. You don't cut the head because of the person is complaining of headache. Someone is having suicidal ideation and you ask the person to go to the prison, or you arrest the person because you want to commit suicide. Suppose you have committed suicide, will you be able to arrest him again? So if someone is having suicidal attempts or ideation, there's need for us to also come on board to help the person. So all these law enforcement agencies should also be trained the best way to handle people, having mental problems. Then what about communities, outreach initiatives? So there's need for us also to build partnership with all these NGOs, local governments, parastatal schools, business owners. Like Dangote, there's nothing wrong with Dangote to come to Yaba and say, okay, what are your needs? And help us. A lot of people will benefit from it. A lot of people will benefit from it. So these are the things we can also do in partnering with all the successful businesses that come to Yaba. Government should also shift their focus more.
I will have to cut you. Sorry, our time is almost up. We have just about 6 minutes, and I know this conversation cannot end there. It can't end there. It has said so much about people-friendly policy, mental health, advocacy and awareness creation, peer support network, economic reform, and quite a lot. Now, quickly, we're going to take Mr. Wale Biyokun, who is going to talk about the psychological strategies, coping strategies that people can adopt, especially now. Let's go home. Yes, we are not suicidal. We do not have ideation. We do not have intent and whatever. What are the coping strategies that people can adopt? Quickly, Mr. Wale Biyokun, in 2 minutes.
All right, thank you very much. I'll take this very quickly. Talking about this psychological strategies one can actually adopt when having suicidal ideation and the rest of that. Yes, after identifying most of these warning signs, it is very, very important that we don't take them for granted. We need to switch into action immediately. And the first thing, just to what we call the crisis intervention. It's an emergency response, crisis intervention, whereby you try to identify most of those things that could be responsible for most of those suicidal ideations or that intent to actually want to commit suicide, and try as much as possible to address them. Second has to do with cognitive restructuring. You find out that most of these issues are a result of probably faulty thinking pattern, So you go as far as challenging most of these negative thoughts or beliefs this individual have, why he wants to actually commit the suicide. What are those reasons why? It might just be a cognitive thing. So by undergoing most of cognitive restructuring can actually help this individual. Then there's emotional regulation skills. When an individual cannot control intense emotions, you just be thinking the best way out is just to die by suicide. So when you are able to teach this individual emotional regulation skills, it will go a long way in actually helping individual deal with his emotions, deal with ways he can actually use to mind. Then mindfulness technique, helping this individual to focus on the present, thereby reducing distress, could go a long way, but could go a long way by helping this individual. These are a lot of psychological strategies you can actually use to actually help this individual. Then problem solving skills, by identifying most of those coping strategies, factors that could actually be contributory factors, probably stressors, and whatever thing it could be. You could go a long way by helping this individual resolve most of these issues. Go a long way. Then also supportive environment. It's very, very important that our environment is one thing you always check about. If the environment is not conducive enough, you have to probably think of changing environment. The environment has to be very stimulating, has to be very conducive. So if all these things are not put in place, definitely there's no how. So these are psychological strategies you can actually use to actually help an individual who is going through a lot, probably who is going through suicidal addictions and the rest of that. There could be more, but I think I will have to stop here, due to our time. Thank you.
Thank you so very much for your understanding, Mr. Wale Biyokun. And no, he has talked to us about some of the things that we can do in changing the narrative in terms of the psychological dimension. And one of the things I hear him say is reframing. Honestly, you can look at it from another perspective. It doesn't have to be that one way. It doesn't have to, you don't have to be stereotypical about living. You don't have to be stereotypical about how you're doing things. If it's not working, then change how you're doing it. Then another thing he said is mindfulness. Be aware, what are my thought processes? What are my thought patterns? How is it affecting me? You have control over that. Our thought doesn't control us. Now, there is a question on the chat box as we were rounding off. It's usually one for Dr. Maitame. He said, in this era and age where everyone is very quite secluded and private, how do I bond with my neighbors and it doesn't look like I am nosy or being forward? All right, so Dr. Maitame, this is specifically for you. Over to you.
Quickly, thank you very much for the question. And I understand where you're coming from, especially for those who have migrated, who have Jackpa, where everybody is mind his business, let me put it that way. I'll give you, I'll take a leap from myself, if I can put it that way. You need to join as many groups as possible. Either secondary school groups, university groups, groups at work, groups at church. Have people you can relate with near or far. If they are far away, at least you can join a place of worship, church, mosque, or any of those. You can also meet people in sports places. Pick a sport, do a sport. You meet people there you can always talk with. Also, you can network. If there's a community program, there may be, for example, they are cleaning the environment. Don't stay indoors. Join your neighbors. Join your street people and connect with them. That will go a long way to help you overcome loneliness or being alone. Also, you can visit family. Family, well, some people don't have family close by. There are friends who would want you to visit them. Visit family, visit friends as well. In summary, don't be alone. Don't be an island. There are many places to meet people and network and connect with people. Work, place of worship, sports centers. You can volunteer and meet people there too. So I don't think neighbors alone are the people you need to stick with. There are people everywhere who are ready to meet with you, connect with you, listen to you, bond with you, and be your friend. Thank you. I hope that's answered the question.
Thank you so very much, Dr. Maitomi. And what I heard him say is don't streamline yourself or don't limit yourself to just your neighbors alone. When you talk about neighbors, it doesn't have to be this person living close to you. It could be virtually a whole lot of people around you, and so you could connect that way. We seem to have very few questions today, but for everyone who had joined, we want to say thank you. Veronica again that says this is quite explicit. Thank you for being on this call with us today. We'll be taking the last comment from our speakers as we begin to round off. Dr. Maitomi, just let's have your last word, please.
Yeah, last words. It's been quite educative, and I'm glad for this opportunity to speak. So I won't say much. Like I said earlier, I've been personally affected by people who have committed suicide, friends, and people who have also attempted, also my patients, and it can be quite painful because we are losing young people, and it should not be so. So one critical thing, and that the bottom line is, people feel alone, no one to talk to, and they feel there's no point continuing with life. Please, people love you, people care about you, people want to listen to you. So please pick up. You're not alone. Suicide is not the way out. If you need help, please visit the hospital, speak to a professional, call the helplines, and I'm sure we can help you out of this place, this dark place you are. We're looking forward to hear from you. Thank you very much.
All right, thank you so very much. Dr. Maitomi says there is a helpline that you can always connect with, even in the dark spot that you are in, and the hospital is one of them. All right, so Dr. Adenibuyo, your last word, please.
Yeah, thank you very much, Dr. Akintoye. I think here also in our hospital, we can also start looking at changing the narrative on suicide, apart from suicide, about mental health. You know, this facility has been tagged Yaba left. So why don't we even change the narrative from Yaba left to Yaba change? You know, something that can also bring people, you know, creating awareness, reducing stigmatization. All this can go on and on. Open conversation or compassionate, you know, conversation about suicide or mental health can also go a long way. What about policy makers? They should also listen, you know, let them fund, you know, psychiatry, also all these mental health, you know, facilities. Let them give, you know, well-funded, you know, then people will be able to help, you know, people having mental disorders, because mental disorder leads, you know, to all the suicidal ideation attempts and committing suicide. So I believe that if our government is also shifting the narrative now, focus on mental health of our people, it's going a long way to help a lot of people in overcoming all the suicidal ideations and attempts. Thank you very much.
Thank you so very much for that. We all need to come together. Everyone has a role to play in ensuring that we can deal with this as adequately as possible. Thank you so very much, Dr. Adeniboyo. Mr. Wale, do you offer your last word, please?
All right, thank you very much, Ma, for this opportunity. Well, I like my other speakers had actually said, you know, the theme is changing narrative on suicide, and it's very, very important for us to start doing things right. And I just want to say that suicide, yeah, a lot of factors could actually predispose an individual to attempt or don't think of suicide. But don't, whatever challenge it is, you know, like I usually say, challenge is a bus stop in Ibadan. It will definitely pass through. So whatever you're going through, always feel that that phase will definitely pass. always speak out, try to reach out to people. You speaking out is not a sign of weakness. It's not a sign of weakness at all. Try as much as possible to get help. If you can't get help from the immediate environment, you can escalate it. You go to the hospital, try to talk to people, talk to professionals about whatever symptoms or whatever you're feeling. By so you actually get help. And by doing that, you definitely, will change the narrative of society. Thank you very much.
Thank you so very much, Mr. Ibiokun Olawale. There is a comment on the platform. The name is there, but I do not want to murder this name by not calling it properly. So you pardon me if I do not mention your name, but I'm going to take the comment. And it says, thanks, Dr. Maitami, for your emphasis on civic engagement as a way to bond with neighbors. Being available when problems are being solved is a sure way to engage with neighbors. Thank you so very much, everyone, for being on this call. Today, it seems like we have quite a few questions from the audience, but I want to believe that our speakers have done quite a great justice to the conversation today. The topic, again, is changing the narrative on suicide. It's a reality in our world today. Gone are the days when it's something that it's not happening in our world, but it's so prevalent in our world today. And so we must understand that for every one of us to change this narrative, it lies on the shoulder of every one of us. So it has become a national responsibility. Everyone in our local churches, our religious centers, in our schools, in our communities, let's just go right back and begin to change the narrative on suicide so that we can do better, so much more, that the world will become a very better place for everyone to live in. Challenges will always be there, but we can always navigate with all that our speakers have spoken today about in terms of how to cope and how to deal with it. You have a role, I have a role, every one of us have a responsibility. Remember again that every Thursday will come up with Yaba Voice webinar. And please note again that the recording of this webinar is on our YouTube page, Yaba Voice FMPHY, one word, Yaba Voice FMPHY. You would get this recording as well as the recording of the previous episode Voice webinar, and then you can watch it and just make it beneficial for yourself as well as for others. Until we come your way again, October is the World Mental Health Month, and we will have a day specifically where we'll be celebrating the World Mental Health Day. And the topic this year is also something very germane that would help us to be able to function and do so well in our world. So until we come your way again, please ensure that you stay safe. Ensure that you speak out. Ensure that you engage your community in terms of bonding, in terms of interaction. Please note again that you are not alone. Please take care of your mental health. To our speakers, we say thank you. Bye-bye, everyone.
Bye-bye. Thank you.
Thank you very much. Bye-bye.